Hello everyone, this is Josiah International University and University of Rwanda Summer Exchange Program 2021 again. Today we are going to talk on the very interesting topic that is Rwanda health system and health education. The presenter of today's topic is Jean de Dieu. I am a student nurse in University of Rwanda, College of Medicine and Health Sciences and Bachelor of Science in Nursing. As we begin on this health system in Rwanda, let's start by looking on the introduction. Firstly, Rwanda is internationally recognized for its success in offering universal access to health care. And the uniqueness of Rwanda in providing that universal access to health care is by using community-based health insurance to ensure that every last citizen of the country has access to health services, irrespective of his or her economic status. Everyone in Rwanda is able to afford health care because of this community-based health insurance. And to reach on the universal access to health care, Rwanda have decentralized its healthcare services from national level to the level of community based on its administrative structure. And the institution that is responsible for supervision for healthcare both in public health facilities and in private health facilities. To the center of them is the Ministry of Health, which is responsible for providing guidance to all those institutions. So I have said on the how Rwanda have decentralized its healthcare services based on its administrative structure. So in Rwanda, there is the way there is administration is. So to the top level there is central level, which include the ministries and Ministry of Health, which supervise all health facility, is among them. And in Rwanda is divided into four provinces based on geographical location in north, south, east, and west, and also the capital city Kigali. And in every province there are many districts, and those districts have every district have its own administrative structure. And the total number of districts we have in Rwanda are 30 districts. And in every district there are sectors which also have their respective leaders, their respective administrative structure. And the total number we have of sectors are 416. And also in every sector there is a cell, and in every cell also there are villages. And all of those from top level to the village level in community, there are some people, some human resources which are responsible for ensuring that the universal health care is being provided. So let's take a look on the hierarchy of healthcare delivery in Rwanda. I have already said that to the top level of a health system in Rwanda, there is central level where our Ministry of Health is. And this Ministry of Health, as I said, is responsible for providing guidance to other health facilities, either public, either private, so to make sure that the healthcare delivery is being provided in proper manner. And two, below the central level, we have national referral hospitals. And those national referral hospitals, in Rwanda we have five national referral hospitals, and these provide the specialized care for the whole country. And also, these national referral hospitals are responsible for providing supervision to other hospitals, other health facilities in Rwanda. And below national hospitals, there are intermediate level, and the intermediate level include provincial hospitals and the other referral hospitals, and on total we have seven intermediate level hospitals, and those hospitals are responsible for supervision of all health facilities in their respective provinces. Also, we have we have also the periphery level, and this periphery level, they are from the district level as I have presented on administrative structure. I have mentioned district. So every district in Rwanda have at least one hospital, and in total we have 30 district, and we have 42 district hospital, and those district hospital are responsible for supervising health centers and health posts within that district, and to the total we have 500 health centers and 1700 health posts. Rwanda doesn't have only those hospitals, those health centers, but it also have other services. Those services include National Blood Transfusion Service, National Medical Procuring and Storing Service, National Laboratory, Health Professional Council for supervising and monitoring professional practice, and all those institutions are there to ensure the universal coverage of health care services to the whole population of the country. Now, as we have seen, as we are moving from hierarchy of the health system in Rwanda, let's have a look to the service package that is provided at each level of health care. So, firstly, let's have a look at the village level. This village level, it's where in community where people live in. So on this picture, you look at these little children, they are drinking milk. So this is a program in Rwanda where little children are gathered in a community, and they are provided with milk so that to prevent them from malnutrition. So among the service package provided at this village level include prevention, screening and treatment of malnutrition, as you see here on these little children. Also, there are integrated the management of child illness, for example, like malaria. Malaria is diagnosed and treated to the level of community, simple malaria, and also provision of family planning. Some family planning methods are provided in community. Also, there are community health workers, which are those people who live in community and well trained on delivering some more health services. Those community health workers provide a role in providing maternal and newborn health. So they provide some services to those pregnant women, to those neonates. So also in community there are some services that ensure the care for patients living in HIV, tuberculosis, and other major illness. And also, this community have also responsibility. They have responsibility in this behavior change and communication. So this service is provided in the community. Now let's have a look at the health post. So in health post, mainly you see here this man is looking on a microscope. Maybe he is visualizing sample to look if there is some microorganism. Normally in Rwanda, those health posts one health post can serve many villages. So in this health post, there are some service package that is provided there. Those package include primary healthcare services, including promotion, preventive, and primary curative services, like teaching people about behavior change, like providing basic nutrition services, like providing other measures to treat common illness in Rwanda. Also, there is also a basic diagnostic with rapid testing. For example, because in Rwanda it is one of the endemic country with malaria, so this diagnosis and the treatment of malaria has been integrated to the community. Some community health worker can provide a care to patient with malaria, and also those patients can also go to health posts where they can have some more advanced care they can't have in their community. Also, these health posts have also basic package of services for those areas that are far from health center, because mainly in every sector there is at least one health center, but sector is a big region. There are some people who can't have access to that health center. Some that health post provide the exact same of services they would have if they could go to health center. Now let's have a look at the sector level. So at sector level we have health centers, and every sector have at least one health center. As you see, we have 416 sectors and you have 500 health centers. So these health centers, they act to provide some more defined the package by government, and those include curative, preventive, promotion, no, and rehabilitation services. They provide uh, maternal services like delivery. They provide the curative services like providing like assessment, diagnosis, and treatment of common illness in Rwanda, and also they are responsible for supervision of health posts and community health workers operating in their catchment area, as I have said before. Moving up to the district level, in Rwanda, as I said, we have 30 districts, and every one of these districts have at least one district hospital. And in Rwanda, currently we have total of 42 district hospitals. The services that are delivered in this hospital, including government-defined complementary package. For example, this district hospital they can offer some surgical operation like cesarean section and treatment of complicated cases that are not mainly treated at health center. The other thing I can mention before leaving here is that in health center mainly today policy the health center is the worker who work in a health center are mainly nurses, midwifery and social workers. So there are the physician and the other healthcare professionals. They mainly go in health center to provide the services sometime in some days in the year. So nurses and midwifery they are responsible for providing care at the level of health center. And to this district hospital, this district hospital have specialists, they have medical doctors, they have anesthesiologists, and they have other healthcare professionals. And also this district hospital, they are responsible for providing care to patients referred by primary health centers for those complicated cases that are not cannot be managed by those nurses. And also these district hospitals are responsible for carrying out planning activities for health district and supervision of district health personnel to ensure that the life, the health of people in district are being maintained. Now to the top of district level. At provincial level, we have 7 health facilities at provincial level, and those health facilities are responsible for providing complementary package of activities and specialized care including internal medicine, pediatrics, surgery, obstetrics, and gynecology. Now to the national referral hospitals. As I have said, these these hospitals are responsible for providing specialized hospitals serving the entire country, and also they are responsible for medical training of health personnel. This means that if patient have a specific disease, he first consult community health worker in community, and if the care is beyond their knowledge, they refer her or him to the health center, and this health center can manage this case or can transfer this case to district hospital. And if this case can't be managed to district hospital, maybe due to availability of resources, maybe due to it requires specialized care, this patient is referred to provincial hospital. And if the provincial hospital can't be able to provide the care to that patient, they refer him or her to national referral hospital. To the top level of health system in Rwanda. At central level, there is a Ministry of Health, and this Ministry of Health have many responsibility to ensure that healthcare services are being distributed to the whole country according to the plan, and they are responsible to develop, disseminate, and coordinate the implementation of health policies, strategies, and programs. They are also responsible for regulating the health sector, monitoring and evaluation of the implementation of policies, strategies, and programs of health sector and other related sectors. In addition, they are responsible for developing institutional and human resources capacities in health sector, and also they are responsible for innovation in health financing approach for accessibility to the quality health services. Central level, which means Ministry of Health, is also responsible for overseeing all institutions, all health institutions, whether private, whether public, a health institution in Rwanda. They are responsible also to mobilize resources for the development of health sector and other related programs. This Ministry of Health is also responsible for developing medical cooperation and coordinate health sector development partners to have international partners in order to ensure that the health delivery healthcare services are being distributed to the whole community. In addition to all those health facilities in Rwanda, Rwanda also has a vibrant private health sector, which they have in private sector. We have two general hospitals, we have two eyes hospitals, we have 50 clinics and polyclinics and 8 dental clinic. We have 4 eye clinic and 134 dispensary, and all those contribute to ensure the well-being of people of in Rwanda, to ensure the healthcare services the distribution to the whole population. Now, as we move on to the next point of the health education in Rwanda, let's have a little look on how this health education is built. So, like other professions in Rwanda, every student in Rwanda have to pass through primary school where he obtain basic education, he do national exam, and then go to the secondary school where we have ordinary level, and then at this ordinary level, student have to pass national exam to go in advanced level. So once they finish advanced level, they choose the faculty they will study in university. This is same for all professions. And by choosing this faculty, that's where some will join medical schools, some will join nursing schools, some will join midwife school, among others. Some will go in a public university, or they will go in a private university, depending on grade and how they have money to pay for private university. Also, in overview, currently there are one public nursing and midwifery school which offer advanced diploma, they offer bachelor program and master's program, and also PhD. And also in Rwanda we have a medical school in University of Rwanda that offer to the level of PhD. And in Rwanda we only have one public university, which is called University of Rwanda, as we are interacting with Josa International University. In Rwanda, there are also other 4 private universities that offer program of nursing and midwifery, and also we have one private university that offer medicine. So, as we look on the universities and higher learning institutions that provide health-related course, we have one university in University of Rwanda. It offer health-related courses. And among private university, we have what is called the Ruri High Institution of Health, which offer nursing and midwifery. We have Tibogora Polytechnic, which offer midwifery, nursing, and laboratory sciences. We have Mount Kenya University, which offer nursing and public health. We have Ines Ruhengeri, which offer laboratory sciences, and we have University of Global Health Equity, which offer global health and medicine. So this is the end of our session on health system and health education in Rwanda. These are references for further reading on health system and health education in Rwanda. I thank you all for listening to and watching this video, and I encourage you to come and visit Rwanda to see how we've achieved so far the universal healthcare to the whole population. Thank you all.